Hello, my name is Deirdre Parker, and I'm a student from Indiana State University. Today, I'm going to speak to you about AEDs. This is an automatic external defibrillator, which can be used to save lives. First of all, what is an AED? Well, an AED is a machine that's brought in that can be attached to a human victim that their heart has stopped. And we're going to demonstrate during this presentation how to use an AED. The Good Samaritan law protects anyone who chooses to use an AED or perform CPR to any victim that is injured or harmed. In the first 5 minutes of someone being down is the most critical time to react and start CPR or use an AED. 95% of cardiac arrest patients die before they get to the hospital simply because no CPR or an AED is not used. So we could save a lot of lives if we learn today how to use this AED. The statistics show that 1 out of 3 Americans, and if you look around your classroom, that's 1 out of every 3 of you will be affected by heart disease at some point in their life. Are AEDs just for staff members? No. Anyone, the lay person, the average person, may use these. It's simple to use, and again, we are going to show you in this presentation how to use an AED. Now, I have some volunteers that are going to help me, so we're going to begin this process of how to use AEDs and save lives. Now we are going to present how to use an AED and what the proper procedure is. I have 2 volunteers here, plus Nick down here on the ground. He is unresponsive. The first thing you do when you find a patient or a victim is you walk up to the victim and say, Nick, are you okay? Are you okay? There's no response. Go call 911, please.
On it.
Is there anybody here that is able to do CPR? That's me. I'll help out with that. Can you go get the AEDs for me?
Hello, 911. My friend Nick's passed out.
So then, if you know CPR, you start the procedure of doing the chest compressions and the breaths. If you do not know CPR, it is important to know that getting an AED is a vital step because you can save the person's life. The AEDs we have here at the school are 2 different types. We have a semi-automated and an automatic one. And I'm going to show you what happens when you open these up. Now keep in mind, the person that knows CPR is going to be doing the CPR while the person, you, would be opening this AED up and putting this on the patient. Here is the AED and what it sounds like when it's opened up.
Call for help now. Remove all clothing from patient's chest.
It gives you time to remove
Pull
clothing.
red handle to open bag. Look at pictures on pads. Peel 1 pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly. Peel other pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly. Remove all clothing from patient's chest. Pull red handle to open bag. Look at pictures on pads. Peel 1 pad off blue plastic. Apply pad to bare skin.
Okay, we get the idea of what this does. It tells you step by step how to apply the electrodes, which are the pads that go on your victim. You want, and it shows you pictures, you want one in the chest area above the breastbone and then one on the side. And it's always the left side that you place the second one, and usually the pad goes above the right side. Now there are two types, so I'm going to show you the second type that we have here in the high school. Because you need to know this. This is important, because if you find a victim down, you need to know what to do. Now this one is, the first one I showed you was semi-automatic. This one is automatic. It's going to automatically deliver a shock.
Stay
if
calm.
the
Follow these voice instructions.
patient needs
Make
a
sure
shock.
911 is called now.
It's going to instruct you just the same. I'm not going to go through what all it says. But it's going to, like I said, deliver a shock to the victim if their heart, if after it reads them, their heart needs a shock. Something you should be aware of when you're applying the AED on your victim is that it's not going to shock you if it has to shock your victim. It will tell you clearly to move away and a shock needs to be delivered. Now that will be your automated system. The semi-automated system will tell you to actually push a button to deliver a shock. So you will know between the two systems what you need to do, and you will stand clear of the victim. Now, when you are calling 911 or calling for help, make sure your cell phones or your portable radios are within 4 feet away from the victim while the AED is reading, because it can interfere with the readings. Okay, now, after you've had the AED in position, and if it's delivered a shock or if it hasn't, if your patient comes back to consciousness, so he's waking up, the first thing you do is put them in the recovery position. You stretch the arm out, turn them on their side, bend this knee backwards, like that, and leave them in the recovery position until emergency medical staff can arrive. AED leads or electrodes stay on the patient. Do not take them off. Then when emergency services gets here, they will check him out and determine if he's okay. Now, if he does decide to sit up, you can allow him to sit up if he wants, so you can go ahead and sit up.
Great.
But if not, just leave him in the recovery position, because that is the ultimate position for an injured victim. Do you need to know CPR when you're delivering an AED? No, it's not necessary. Studies show that if you apply the AED, even if you don't know CPR, it's going to increase their chances of surviving. So now, if you do want to take a CPR class in your future, it's a good idea. So a lot of the local area hospitals and clinics offer classes, so it'd be something to look into if you desire. The first location is outside the nursing clinic. The second location is at the Leonard Auditorium and the Fine Arts Hall. The athletic department has one in their office. The hallway between the lecture hallway has another one located on the wall, and also our trainer has one here on him or in his office at all times. So these are the locations that are important to remember if someone gets in trouble and needs an AED. Now, we're going to review the questions that were asked to you prior to viewing this video. Some of the important questions asked are, what is an AED? This is an automated external defibrillator. The Good Samaritan law provides protection to someone who renders aid to an emergency or injured person on a voluntary basis. The best chance for survival for a victim is within the first 5 minutes. It is estimated that 95% of cardiac arrest victims die before they even reach the hospital if CPR or an AED is not used. AEDs are not for just trained personnel. Any person can use an AED. As you saw in this video, it shows you step by step what you need to do, plus provides pictures on where you need to place the leads or the electrodes. AEDs obviously save lives. Your first step when you find a victim is determine if they're unresponsive. Do you have to know CPR when you have an AED? No. You can use an AED regardless if you know CPR. Again, it is helpful to know CPR, but if you don't, you still want to go ahead and use the AED if it's needed. Obviously, as we've stated, the AEDs do provide visual and voice prompts to give you step-by-step guidance throughout this process. The first step you do when using an AED is simply turn it on. Just turn it on and listen to what it says. The electrodes are provided for children and adults in the kit, so you can determine on your victim, if it's a child or adult, what size you're going to use. The AEDs do not shock you when you're administrating them because they tell you to either push the button or stand away, so you stay clear from the victim when the shock is being administered. It is a good idea when you're calling 911 or talking to somebody on a cell phone to stay 4 feet away from a patient or a victim when the AED is reading the heart rhythm, because this can interfere with the reading, so it's very important to stay away from it with those items. If the victim should recover and become conscious again, the best position to put them in is in the recovery position, as we showed in this video. Turn them on the side, put their arm out and arm across them, and leg straight, and the top leg turned or bent over on the side. And this allows for them to be in the best ultimate position for the emergency staff to come in and evaluate. Thank you for this presentation, allowing me to do this presentation, and I hope you all learned a lot about AEDs today.